So what we presented at ASCO 2020 was the DREAMM-6 trial, which is evaluating the safety and tolerability of the combination of Belantamab mafodotin in combination with bortezomib and dexamethasone among patients who have relapsed multiple myeloma. So what is Belantamab? It's an antibody drug conjugate that targets the B-cell maturation antigen that is present on the matured myeloma plasma cells. It causes the myeloma cell death by various mechanisms, including immune-independent mechanisms, ultimately leading to myeloma cell death. What we had seen in the DREAMM-2 trial is that this is a very active compound among patients who are heavily pretreated. So median of 6 prior lines of therapy were administered in DREAMM-2, and patients tolerated the drug well, and it showed a clinically meaningful activity among these heavily pretreated patients in the DREAMM-2 trial, which led to evaluating this combination or evaluating this drug with other drug combinations in earlier lines of therapy. So what DREAMM-6 did was to evaluate the same drug with Belantamab mafodotin in combination with lenalidomide and dexamethasone in one part of the study, it's the part A. And in part B, it was evaluating in combination with bortezomib and dexamethasone. So there are several cohorts that are enrolled in the specific part B portion, but the portion of interest was the specific 2.5 milligram per kilogram given every 3 weeks with a standard backbone of bortezomib and dexamethasone. So now there are 4 cohorts and enrolled a total of 59 patients to date. However, the one that has a good follow-up and the combination that is moving forward was the 2.5 milligram per kilogram given every 3 weeks, and that is the cohort that I'm going to present. So there were a total of 18 patients that were enrolled on this specific arm, and median age was 67 years. A third of the patients were high risk. A fifth of the patients were African American, and the combination was very well tolerated. So I'll start with the toxicities first. And when I look at these toxicities with any antibody drug conjugate or any monoclonal antibody in general, the things that I want to look at is how well is it tolerated at the first place with the infusion in relation to the infusion-related reactions. So it was seen in around 17% of the patients, and literally no patients received any pre-medications before. The protocol did not mandate them. So in general, these are very low grade, and patients tolerated these very well, and these are very well manageable. The second aspect was thrombocytopenia. Even though these were grade 3 and grade 4 events, by the time that the patient was ready for the next dosing, these have resolved to baseline. So again, an adverse event that is seen, but not of much clinical interest. The third one that I'm very focused on, the adverse event of interest, is the corneal toxicities. So these are seen in most patients. So corneal toxicities in the sense of keratopathy, in the sense of dry eyes, blurry vision. This is a toxicity that was seen previously in the DREAMM-2 trial as well. And one thing I want to clearly say is no patient lost vision because of the drug. These are toxicities that are associated with an antibody drug conjugate carrying this payload, and these are manageable. So every patient goes through an ophthalmology exam before the patient gets the drug. And if there is a toxicity that is precluding patients to go receive that dosing, that is absolutely perfect. We hold off on the dose based on the toxicity. And when you look at this specific way of how the drug is given, we had clearly seen that it can be delivered without major toxicities in a manageable way, and that's what we had seen in DREAMM-6 trial as well. So there were toxicities that were seen from corneal events, and these are manageable, and certainly these were a reflection of what we saw in the DREAMM-2 trial as well. And we don't have as much of a longer follow-up to evaluate if these toxicities have resolved as of today. From an efficacy standpoint, what we are seeing was a good response when you look at the response rate, these were 78%. Clinical benefit response rate was seen in 83% of the patients. And more importantly, deeper responses were seen with VGPR rates of 50%. So to summarize, it has a manageable safety profile, and it does have a good depth of response in alignment with the other trials, other combinations in this space. And with bortezomib dexamethasone, there were no new toxicity or safety signals that were seen.